Okay, good day, future nurses. Today we're going to discuss your stress and trauma-related disorders. Okay, so people usually experience events in their lives that are extraordinary or in intensity or severity well beyond the stress of their daily life. Okay, wherein these traumatic events or stressors would actually be expected to disrupt the life of anyone who experiences this one. Okay, not just an individual at risk for mental health problems or issues, but also with large group of number of people. So, una muna, we have here your PTSD or your tinatawag natin na post-traumatic stress disorder. Okay, so ano bang ibig sabihin ng PTSD? Sir, ibig sabihin po ng PTSD, okay, that is just the stress, after a traumatic event or a disorder following exposure to extreme traumatic events. Okay, and it should actually last or should last for at least 1 month. Okay? And then, what are the different causes of your PTSD? Number 1, we have your disasters, your calamities, your violence, your war, and even your rape. Okay, di ba? Usually, our country is very prone to many typhoons. Okay, if you could still remember your Typhoon Yolanda, okay, way back in November of 2013, super typhoon siya, sobrang lakas nung bagyo na yun, and it affected a lot of people, okay, in Tacloban. And if you could imagine their their experience during that time, grabe. And most of them, hindi lang po physiologic needs ang kailangan nila or needs assistance or support, but also with their meron kasi siyang psychological impact during that time. Okay, that's why kailangan talaga dapat ng intervention, okay, ng psychological or psychotherapy natin doon during after the typhoon. Okay, kasi number 1 na nagko-cause ng PTSD is your calamities or your disasters. Okay, natural disasters natin, and even those people who are nasa places na risk for mga merong conflicts. Okay, a political conflicts, that's when nagkakaroon ng violence or even when, or of course, with your sexual abuse, including your rape. Okay, and then what are the clinical manifestations of patients who have PTSD? Okay, for patients who are, or for clients who are more than 6 years old, mga adult, number 1 is that we have your tinatawag na hypervigilance, your flashback, your avoidance, dissociation, and your detachment. So, sa hypervigilance, ano bang ibig sabihin ng hypervigilance? Ibig sabihin nito, the other term for your hypervigilance, tinatawag din natin siyang hyperarousal. Okay, tinatawag natin siyang hyperarousal. Wherein, pag sinabi natin hyperarousal or hypervigilance, that is just the act of being on guard. Okay, being on guard. Ibig sabihin nito, of course, since nagkaroon tayo ng traumatic experiences, okay, pag tayo ay na-expose ulit, okay, we tend to avoid that situation by being hyper-vigilant with ourselves to protect ourselves. Okay? And next, we have here your flashback. Anong ibig sabihin ng flashback? Okay, nagkakaroon ka ng re-experiences. Okay? Through what? Re-experiences ng trauma na na-experience mo through dreams, okay? Or through situations na pwedeng mag-expose sa'yo, okay, that are actually associated with that situation kung bakit ikaw ay na-trauma. So, tandaan natin sa flashback together with your nightmares, okay? Flashbacks together with your nightmares, they are considered as your 2 cardinal signs, okay, that indicate na meron kang PTSD. Okay? And aside from that one class, we also have here, okay, avoidance. Bakit nagkakaroon tayo ng avoidance? It's because sabi nga natin, tawag dito, we tend to avoid, we tend to suppress or repress that feeling or tawag dito, that situation, okay, that is actually associated with traumatic events that we experiences in the past. Okay, and of course, we also have here your dissociation. Bakit tayo nagkakaroon ng dissociation? It's because this dissociation is just the defense mechanism, defense mechanism of a patient who have PTSD. Bakit siya nag-dissociate? Every time na nakaka-experience siya ng mga situations that are associated with his or her trauma, it's because number 1, that is just a way, no, to protect their emotional self from that reality and traumatic events. Okay, aside from that one, we also have here your detachment. Nagkakaroon sila ng detachment from reality or the traumatic event kasi nga ayaw nilang ma-experience ulit or ayaw nilang magkaroon ng re-experiences with that event na nag-cause sa kanila ng trauma. Okay? So aside from that one class, ang PTSD kasi or the other stress related disorders, no. Okay, some individuals kasi they continue to have problems coping, okay, managing stress and emotions or resuming the daily activities of their lives. That is why ang importante dito, our role is to help them to return to their usual levels of coping. And of course, perhaps even enhancing their coping as a result of dealing with that event. So, yun ang number one na isa sa mga goal natin to assist them, okay, to go back to that optimum level of functioning para, and of course, to teach them with their coping strategies kung paano sila makakapag-cope or paano na i-deal yung mga traumatic experiences nila. Okay? So, how about with those patients who are less than 6 years old naman? Okay? Ang kanilang manifestations, we have here your repetitive play and reenactment. So, for example, in the case of your rape, okay, for example, pag na-rape ang isang bata, ang pwedeng manifestation niyan, class, of course, ang mga rape victims natin, they have higher risk to develop your PTSD. So, for us to determine kung nagkaroon ba ng sexual abuse yung isang bata, makikita natin sa kanila yung nagkakaroon sila ng repetitive play or reenactment ng event or ng traumatic event na nangyari sa kanila. Okay? And aside from that one class, we also have here, okay, so what will be our, tawag dito, other manifestations. So, nagkakaroon sila yan ng depression. Okay? Because of what? Because of that suppressed emotions na dala-dala nila. Okay? Wherein gusto nilang kalimutan yan that will actually distract, okay, their emotions or their moods. Okay, that's why nagkakaroon sila ng depression or even irritability or outbursts of anger. Okay, and aside from that one, nagkakaroon din sila ng exaggerated na mga startle response as part of your hypervigilance or your hyper-arousal. Okay, so what will be our interventions? Okay, what will be our role, no, as a nurse for patients who have this situation or condition or your PTSD na tinatawag natin. Of course, number one, we have to establish trusting relationship. Bakit? Kasi kasabi natin, nagkakaroon sila ng hypervigilance. Okay? Nagkakaroon sila ng avoidance wherein they do not have that courage, no, to verbalize their painful experiences. That is why what we can do here is to establish your trusting relationship. We have to we have to encourage verbalization about their painful experiences with consent, of course. And of course, we have to show empathy. Okay, number one yan, we have to show empathy to them by how? By not being non-judgmental to them. We have to help them feel safe, that it's open for them. Okay, that's okay for them to be vulnerable when it comes to, verbalization of their traumatic experiences. Okay, and of course, we have to talk about the situation vividly until the person is able to tell the story without feeling upset. Okay, kailangan natin ng rational emotive therapy. We have to allow them, okay, to acknowledge, to grieve, we have to allow them to, tinatawag natin na, identify and label and express their feelings safely. Okay? And of course, we also have here your grounding na tinatawag. Ano bang ibig sabihin ng grounding? Ibig sabihin nito, that's the time that you could actually help them to, we can actually give them questions like what? Ano yung mga possible na questions natin that can actually be part of your grounding technique. Okay, so sulat natin dito. Possible na mga questions natin. We have to, sorry, wait lang class. Ayan. Okay, gagawin natin dito classes that we have to ask them that questions that could actually help them para maiana natin sila. Like what? Anong mga questions na yun? Number one, we have your... Okay, wait lang, pas naglolo ko yung pen ko. Wait lang po. Okay, ay gumana ng pen ko, class. Wait lang, ha? Okay, so let natin, we have here, what are the grounding techniques or the questions that we could ask to our patients is that number 1, we have here, can you feel my hand? Okay, ganyan. Can you feel my hand? Just for us to be able to allow them to experience, okay, to, tawag dito, para maano natin sila to keep or to get track or back on track, okay, on reality. Okay, can you feel my hand? Or can you feel your hand? Okay, can you feel your feet on the grounding, mga ganong techniques class para ma-reorient natin or para maano natin yung client natin, para ma-assess natin yung client natin to go back to reality. Kasi kasabi natin, yung mga patients natin, no, they tend to dissociate, okay, they tend to, yung tawag natin na, what they call this one, tinatawag natin na avoidance, okay, they try to avoid situations that could actually lead them, okay, to certain events that are associated with their trauma. Okay, so we also have here yung iba't ibang psychotherapy natin, no? Okay, number 1, we have your diffusing. Okay, ano bang ibig sabihin ng diffusing natin? That's the time that, okay, sulat natin ulit. Ibig sabihin ng diffusing ay, ginagawa ko ulit yung pen ni Sir. Okay, diffusing, we have to provide education, okay, on stress and stress management. Ibig sabihin ng diffusing, provide education, okay, providing education on stress and stress management. Kasi sabi nga natin kanina nung una, no, ang number 1 na role natin here is to what? Is to help them to cope with that traumatic events in their lives. Okay? And of course, next here, we have your debriefing. Bakit kailangan natin i-debrief yung client natin? That's why every after disasters, every after traumatic events, kailangan talaga ng counseling. Okay, dyan dapat pasok yung counseling or as part of your counseling, we have your debriefing. Bakit? Kasi kailangan natin i-debrief yung mga clients natin. Okay, to allow them, no? And of course, we have to ask them about their, so that natin emotional reaction to that event. Okay, we have to ask them, okay, about their emotional reaction to that traumatic events para hindi sila magkaroon ng acute stress disorder that will soon lead with your PTSD na tinatawag natin. Okay? Bakit kasi kailangan nating alamin yung mismong psychological or emotional impact, okay, ng mismong event sa kanila para ma-acknowledge nila yon. And of course, pag na-acknowledge nila yan, hindi na sila mas mahirap ang i-acknowledge or i-verbalize kung anong nagiging reaction nila or hindi na nila i-repress kung anong mismong emotions nila with that certain event. Okay, and of course, we have your exposure therapy. Anong ibig sabihin ng exposure therapy natin? That's just the time that we are going to confront, no? Confronting trauma. Okay, so natin confronting trauma rather than avoiding, no? Kasi sabi natin as part of your defense mechanism ng patient na merong ganito is that they tend to avoid, okay, they tend to repress kung ano man yung nararamdaman nila. That's why yung exposure therapy natin class, it is actually a treatment approach, no, to design to combat the avoidance behavior that usually occurs with your PTSD. Okay, by how? Okay, tinutulungan kasi natin yung client natin, no, to face troubling thoughts and feelings, and of course, they have to regain measure of control over their own thoughts and feelings. That's why yung client natin, they confront lahat ng mga feared emotions nila, okay, mga situations, and even thoughts that are actually associated with their trauma, rather than attempting to avoid them. Okay, of course, kakahibat kasi niyan class. Okay, syempre, pag in-expose natin yung client natin, kailangan natin ng ibang techniques, no? Ng tawag dito, ng parang de-escalation or mga tinatawag natin ng mga, ng mga relaxation techniques, no? To help the client tolerate, okay, and manage the anxiety response. Okay, ano mga example nito? Example nito, of course, nakalagay dun sa ILG ninyo is that, example nito, number 1, returning to the place where one was assaulted, okay? Or imagine confrontation that would actually mentally place oneself in that traumatic situation. Okay, for example, kung saan ka nagkaroon ng traumatic events, i-expose ka nila ulit dun, ilalagay ko nila ulit in that specific place para magkaroon ka ng experiences. Okay, and of course, instead na i-avoid mo yung situation na ganon, you're going to confront that feared emotions or situations or thoughts associated with the trauma rather than attempting to avoid them. So that is your exposure therapy na tinatawag natin. Okay, next naman here, we have your adaptive closure therapy. Okay, we have your adaptive closure therapy. Ibig sabihin, example nito, para hindi siya makalimutan, we have your empty chair technique. Okay, meron tayong tinatawag na empty chair technique. Okay? Ibig sabihin nito, class, okay, it's actually a specialized na na cognitive behavior therapy approach developed by your military to offer an intense, okay, specific and short-term therapy for active duty military personnel with PTSD. Kasi bakit kaya nagkakaroon yung mga sundalo natin, no, ng PTSD? Okay, number one, of course, pag sila na-expose sa war, nagkaroon ng casualties na mga kasama nila during that war, of course, meron kasi tayong tinatawag na survival's guilt na tinatawag natin. Wherein the survivor's guilt, very common yan sa mga patient na merong PTSD. Okay? Ano pa? Aside from that, ano bang ibig sabihin ng natin, ng empty chair technique natin? Okay, yung participant natin, okay, will going to what they call this one, will going to tell, okay, say whatever he or she needs to say to anyone, okay, alive or dead man yan nakasama niya. Okay, that's why this one class, tong empty chair technique natin, it is actually very similar to your Gestalt na tinatawag na Gestalt therapy. Okay, very kasi to class, tong approach na to, tong cognitive behavioral technique na natin na to, na approach na to, it is well tolerated and very effective yan, reducing your PTSD symptoms and of course, promoting post-traumatic growth natin. Okay, and of course, we also have here your catharsis. Ano naman ang ibig sabihin ng catharsis natin, sir? Your catharsis, okay, sabi natin during your your discussion of your anger, nagkakaroon tayo ng ng what they call this one, we are going to allow ourselves to feel angry, to feel, we have to immerse ourselves with that specific emotion na nararamdaman natin instead of repressing it. So, pagdating naman po sa natin, sa ating PTSD, pag sinabi natin catharsis, it is a way of releasing, okay, it is a way of releasing your repressed emotional or emotions through art and music. Repressed emotions through art and music. So, yun naman po yung tinatawag natin na catharsis when it comes or related with your ating tinatawag na post-traumatic stress disorder. So, pagdating sa ating medical management, of course, we can actually give what? Okay, medications may be used for clients with PTSD to deal with the symptoms such as what? Ano ba yung problem natin? Ano ba yung usually nagkakos ng problem, okay, nagkakos ng trouble with your patients who have your PTSD. Of course, sabi natin, nagkakaroon sila ng hypervigilance, nagkakaroon sila ng flashbacks, nagkakaroon sila ng mga nightmares, like that. So, of course, ano ba yung mga symptoms that are associated with that? Pwede silang hindi magkakaroon sila ng sleep disturb, natin. Hindi sila nakakatulog, that's why nagkakaroon sila ng insomnia, okay, nagkakaroon sila ng anxiety, or nagkakaroon din sila ng hyperarousal or your hypervigilance. That could actually disrupt their activities of daily living. So, what can we give to them? Okay, study shows kasi that we have your SSRI, okay, that could actually help them to treat that symptoms of your PTSD. Okay, ano bang ibig sabihin ng SSRI? Isa yan sa mga tinatawag natin na tawag dito, antidepressants natin. Okay, so, ang number one kasi na natin dito, class, as part of your, natin, nakalagay dyan your psychotherapy, okay, as part of, and of course, with your medical intervention, ang na kasi natin dito, class, is that we have to show them, we have to enhance their support system, no? By what? Yung mga self-help groups natin, okay, and of course, your family psychoeducation, of course, your socialization, natin, aspects natin, for them to be able to help them to cope with that specific trauma or events that they've experiences in their lives. Okay, kaya meron tayong mga iba't ibang psychotherapy, no? Okay, to help them deal or to help them deal with that specific trauma na experience nila in their lives, in their past lives. Okay? So we have also here, aside from your PTSD, we also have your dissociative disorders na tinatawag natin. Okay? So pag sinabi naman natin dissociative disorders, thus we have here your ibig sabihin ng dissociative disorder, disruption in the usually integrated functions of consciousness, okay, memory, identity, and environmental perception. Diba? That's why, discuss natin to before with your, defense mechanism, yung tinatawag natin na dissociation. Okay, ano bang ibig sabihin ng dissociation natin? Okay, so ang gagawin nila is what? They tend to forget. Okay, they tend to suppress. Okay, they tend to forget subconsciously yung mga events in their life. Specifically kapag traumatic events yan, class. Okay, we have here your dissociative amnesia. Ano bang ibig sabihin ng dissociative amnesia natin? Simply, ibig sabihin ng dissociative amnesia natin, that is just the ability, no, to remember trauma. Inability. Okay, salit natin inability to remember traumatic experiences. Inability to remember traumatic experiences. Okay, of course, sabi natin, bakit kailangan nilang i-repress, okay, yung mismo nararamdaman nila that are associated with your trauma. It's because, sabi nga natin kanina, nagkakaroon kasi sila ng avoidance. Okay, na-avoid nila, they tend to dissociate, they tend to detach from reality. It's because, para sa kanila, nagkakos yun ng stress. Okay, emotional stress every time na na-experience nila or nagkakaroon sila ng re-experience of that extreme traumatic event in their lives. Okay, and of course, we also have here your dissociative identity disorder. Okay, anong ibig sabihin ng dissociative identity disorder? Ito yung tinatawag dati nila na multiple personality disorder. The other term for your DID, before we call them as your multiple personality disorder. Okay, wherein pag sinabi natin multiple personality disorder, nagkakaroon niya ng host, of course yung host is that the original self, okay, you. But then kapag nagkaroon ka ulit ng DID, of course ang natin dito, class, is that tawag dito, you tend to have an amnesia coupled with your sudden travel. And of course, pag nag-travel ka, okay, nagkakaroon ka na tawag dito, hindi yan, yung dissociative fugue yun, okay? Of course, pag nagkaroon ka na ng na-expose ka ulit sa mga experiences mo that are associated with your trauma, nagkakaroon ka ng iba't ibang identities. Okay? Forget your original na identity mo. That is your DID or your multiple personality disorder. And of course, we also have here your dissociative fugue. Ano naman ang ibig sabihin ng dissociative fugue? Nagkakaroon ka ng amnesia coupled with sudden traveling. Okay, coupled with sudden traveling. Okay, ibig sabihin natin, class, okay, pag nagkaroon ka ulit ng na-expose ka ulit, nagkaroon ka ng re-experiences pagdating sa mga trauma mo in your past lives, okay, that's the time na nire-repress mo yun, and then nagkakaroon ka ng sudden traveling. Okay, you tend to go wander. That's why, after wandering, of course, nakakalimutan mo na yung mismong sarili mo, nagkakaroon ka na ng bagong identity. Nagkakaroon ka na ng different identity. Okay, so yan po yung mga iba't ibang natin. Yan po yung mga iba't ibang dissociative disorders natin. So, pagdating sa psychodynamics natin, class, ang tatandaan lang natin dito kung ano ba usually yung nagkakos, okay, ng mga dissociative disorders natin. Of course, number 1, sabi nga natin kanina, nagkaroon ka ng mga past or extreme traumatic events in your lives. That's why nagkaroon ka ng tinatawag natin na dissociative disorders or even with your PTSD natin. And of course, our resolution here, tatandaan lang natin ang pinaka number 1 na natin dito is that we have to help them to cope with that. Ang tawag dito, magkaroon sila ng maayos na coping strategies when it comes to managing your PTSD or even with your tinatawag natin na dissociative disorder. So, ang gagawin natin dito, class, is that we have to help your patient to acknowledge, no? Kasi once na acknowledge nila yung kanilang mga emotions, extreme emotions nila, okay, that's the time that we could actually help them to deal with that emotions na nararamdaman nila. And of course, acknowledgement, acceptance, okay, accept, and of course, we have your tinatawag natin na verbalization. That's why, ang role natin dito, of course, is that we have to be non-judgmental with them. Every time na nakakapag-verbalize sila ng mga situations that keeps them on we have to keep or to be non-judgmental. And aside from that one, of course, ang number one na ano natin dapat dito is that your self-awareness. Okay, kasi what if wala kang self-awareness when it comes to handling with this kind of clients natin, pwede kang madala or pwede kang tawag dito, magkaroon ng counter-transference just in case. And of course, to avoid that one, we have to go back or we have to establish your self-awareness na tinatawag natin. Okay, so that's it for our discussion for your PTSD and of course, your dissociative disorders.